Hi, my name is Clay Rowland. I'm a student physical therapist at South College. Can I have your full name and date of birth?
Brianna Rowland, 7/20/98.
Nice. Okay. Is it okay if I work with you today?
Yes.
Perfect. That's going to involve me putting my hands and my equipment on your chest and upper body. Is that okay?
Yes.
Perfect. And is it okay if we record this for educational purposes?
Yes.
Awesome. So basically what I want to do today is I just want to listen to you breathe. I want to hear the sounds your lungs are making as you breathe in and out air. And I just want to make sure everything's working good and you're nice and healthy, okay? Perfect. So I'm going to ask you to take deep breaths while we're doing this. And I want you to know taking a deep breath is just a nice deep breath in through your mouth and then out, okay? Perfect. So we're going to start with the left apical segment. The apical segment of the the right upper lobe of your right lung. So it's going to be halfway down the clavicle and then just superior. Is it okay if I move this strap just slightly out of the way? Perfect. Awesome. Okay, nice deep breath in through your mouth. Sounds good. And then we're going to do the same spot the other side. Go ahead and look straight for me. All right, nice deep breath in through your mouth. Give me one more. There we go. Good job. Now we're going to do the anterior segment of your right upper lobe, which is going to be at the third rib and then kind of over your nipple line, okay? So we're going to come down first, third, and then just move a little bit laterally. Is it okay if I slide this just a little bit under the strap of your bra? Perfect. There we go. It's going to be just superior of that third rib. And then go ahead and take a nice deep breath in for me. Nice. We're going to go to the other side now. Is it okay if I grab that strap? Perfect. So I'm just going to go again. Very good. Very nice. All right, next, I want to do the anterior segment of your right middle lobe of your right lung. And so that's going to be at the fourth rib and then lateral. Fourth rib and then just over to the side. But just to protect your modesty, I'm going to come up under your armpit, okay? All right, so can you just put one hand on your side for me? And then can you actually, before we do that, can you go ahead and cover your breast tissue for me? Go ahead and cover up top because I'm going to be coming from this side. There we go, there's 4. That's right here. Okay. So, right middle lobe, go ahead, take a deep breath in. One more. Good job. And now we're going to go to the left side. On the left side, this is your lingula. So, go ahead and take a deep breath in. Very nice. Good job. All right. Last one on this side. I want to do your anterior basal segment of your right and left lower lobes. So again, just go ahead and give me that barrier so you protect yourself. I'm going to come to the xiphoid process right here, and I'm just going to come laterally. I'm just going to slide underneath the bottom strap of your bra. Is that okay?
Yes.
Perfect. Go ahead and deep breath in through your mouth. Very good. And the same thing over here. Just going to come right here. Deep breath in through your mouth. Well done. All right. Can I have you flip around for me? So now we're going to do a couple on your back, okay? So first thing we're going to start with is we're going to do the apical the posterior apical segment of your left upper lung. And that's going to be right underneath your trap, okay? Go ahead and take a nice deep breath in through your mouth. Well done. And then the right side, perfect. That was the right side, the apical segment of the right upper lobe, sorry. And now we're going to move on to the posterior segment of the left upper lobe. And that's going to be at T3 and then T3 and then over to the side, over your scapula. It's going to be right at that spine of the scapula. So right here, right there. Can you go ahead and give yourself a big bear hug for me? Nice. There we go. Take a deep breath in through your mouth. Nice. And other side. Very nice. Good job. Go ahead and relax again. Next, we're going to be doing the superior segment, the posterior superior segment of the left lower lobe and then the right lower lobe. Okay, so that's going to be halfway between the inferior angle of your scapula and the spine of your scapula. So it's right here, right there. So go ahead, give me another big bear hug. There you go. Nice deep breath in. Good job. Deep breath in. Good job. All right, now we're going to be looking at the posterior basal segment of your left lower lobe. And that's going to be just superior to T10, between T10 and T7, okay? So is it okay if I roll the backside of your bra up a little bit, the bottom strap? Perfect. So there's your 12th rib. 12, 10. There we go. So there's T10. Let's go right in here. I'm going to slide this just under your bra. Is that okay? Under the bottom of your bra. All right. Nice deep breath into the mouth. Well done. Now the other side. All right. Nice deep breath. Awesome. That was the posterior basal segment of your right lower lobe. Now we're going to do the lateral basal segment of your left lower lobe. And that's going to be the same position, just a little bit more off to the side over here, okay? So we're going to find that T10 again. Perfect. We're going to come a little bit more lateral. And go ahead and take a deep breath in through your mouth for me. Perfect. And then the other side for me. Hold on 1 second. All right. Deep breath in for me. All right, well done. I'm just going to roll this down for you. Thank you for letting me work with you.